Doubling time is the number of days it takes for the number of infected people to double. So for example, a disease with a doubling time of 2 days means that it would go from 100 cases to double that, 200 cases, in 2 days. In the case of COVID-19, if we look at the European outbreak just in terms of doubling time, the situation is pretty dire. So this chart shows the trajectories in terms of number of cases observed in red and the predicted number of cases in black if we assume that the doubling time in these countries does not change in the coming days. It's important to look at the scale here on the y-axis because it's different in each country. So these doubling times are really low, which is really bad. It means that the disease is spreading very quickly. Denmark, it takes 3 days to double. France, 2.7 days. Germany, 2.6 days. Italy, where we're most concerned, was 3 days, but it's actually lower, for example, in Norway, 2.4 days, or in Spain, where it's just 2 days. Now, one caveat here is that we start the calculation for doubling time at the first day at which there is 150 or greater cases. So these numbers would be slightly different if we were to move that number up or down. And since Italy is leading the way in terms of the number of cases in Europe, it's helpful to compare each of these countries with Italy. So let's look at the same chart, but with a blue line showing the number of cases observed in Italy. What we see is that Italy is not the exception, it's the norm. Even though there are many, many more cases in Italy right now, the numbers in the rest of the European countries are going in the same direction, and in some cases are on even a worse trajectory. So even though Italy has more cases, its doubling time is actually better than in some of the other countries, and unless those doubling times go up, the number of cases in some of these other places will quickly catch up with Italy's. Now, the number of cases is not necessarily the best indicator of the magnitude of a disease outbreak, especially in the case of a disease which can have light symptoms or even have people that are asymptomatic. Why is it not the best? Because testing rates vary by place and by time, and therefore when we're comparing things over time and by place, there's a lot of bias. So there's an argument to be made that maybe we should look at deaths instead of cases because there's less bias with deaths. Now, there is still bias with deaths. Of course, the age structure of the population will affect the death rate as well as the quality of health service delivery. But let's assume for a second that deaths is a better proxy for epidemic magnitude and just look at those. So here's this doubling rate concept again, now showing deaths instead of cases. And again, what we see is that Italy and the rest of Europe are not on radically different trajectories. If we overlay the number of deaths in Italy with other countries, we see there's a lot of variation, but those doubling rates are not radically different from the doubling rates in terms of confirmed cases. So whether you look at cases or deaths, it's important to keep in mind the concept of lag. And lag means that when you do something, the effect of it is not seen until some time later. That is, today's clinical cases are people who got infected about a week ago. And if you start preventing cases today, you won't see the effect in terms of cases until a week from now. And in the case of severe cases or deaths, the amount of lag might even be greater. A lot of European countries are now taking serious measures to stop the contagion, but the effects of some of these measures won't really be observable in these trends until next week. But they will have an effect. Social distancing works. And we can already see the effect in Italy. Again, even though the number of cumulative deaths and cases is extremely high, the trend is starting to change. The doubling time in terms of cases and deaths is starting to go up in Italy, and that's good.